Mr. Chair, we're live. You may proceed.
Thank you. Well, good afternoon. I call to order this special meeting of the University of Minnesota Board of Regents, and a good afternoon to one and all. Thanks to those who are joining us via the live stream video and in person in the boardroom on the Twin Cities campus. Just a couple of quick notes about our protocol today. First, since we are meeting in a hybrid format with a majority of us online, we will take roll call votes for our action items. And second, Zoom participants, please use the raise hand feature if you wish to speak. And Regents in the boardroom, alert Mr. Steves if you'd like to speak. So we have two items before us for action, and we'll turn right to our agenda. Our first item is the resolution related to change to university immunization requirement. And it is before us today for review and action. President Gable, I'll turn it over to you for your comments and your recommendation.
Thank you, Chair Powell, Vice Chair Spigum, and members of the board. As the fall semester approaches, I know we're all very excited and optimistic about an incredible in-person on-campus semester. But as we know, we must continue to remain vigilant in our ongoing fight against the COVID-19 pandemic in order to ensure that that fall semester is safe. I share concerns that much of our broader campus community have brought to our attention about the recent Delta variant spike and the increase in positive cases in our community across the state and around the nation. But as you know, members of the board and those of you listening, the health and wellness of every member of our university family has always been our top priority, as is ensuring that we are safely able to be together this fall. So as a result, earlier this week, and in ongoing consultation with faculty, staff, and student government leaders, and for action before you today, we elevated our Get the Vax plan to Get the Vax 2.0. We believe this step, which is part of the overall incremental set of decisions that we've been making all along through this pandemic, based on data and the informed opinions of our experts and our partners at the state and federal level, that this step will allow us to make yet another graceful pivot. We still have a healthy appetite for those so that we can have normal campus activity this fall and an uninterrupted on-campus semester. The full plan is under development. There are a lot of operational details that we are still working on behind the scenes, specifics, consequences, et cetera, that we will share with the university community soon. But we do have before you an underlying policy change that I would like to present to you in the context of the overall updates to the plan under Get the Vax 2.0. So first, with masking, the framework for masking that we announced a couple of weeks ago remains intact under Get the Vax 2.0. This piece of the plan is informed by recent CDC guidance around county level transmission data. We've been reviewing this transmission data regularly. In fact, I just got the last report for the counties that surround most of our system campuses at around 11:15 this morning. And we use this data, ongoing guidance from the CDC and the Minnesota Department of Health and our own public health expertise. And that has informed the decision to have an indoor mask mandate. And we will regularly review that mandate as the data fluctuates and changes. But even since we put in place the indoor mask mandate, new public health data has come to light, most specifically the rapid and widespread transmission and resulting demand on our healthcare system caused by the Delta variant. And we also understand that FDA approval of at least one of the vaccine tools is imminent. And that combination has us before you today, seeking a change to the policy for student vaccinations. So just to be clear, we already have a policy that requires students to be vaccinated. And what we're asking for today is that policy be updated upon FDA approval of any COVID-19 vaccine, which we anticipate in the coming weeks, to add the vaccines to those immunizations already required for students, with exemptions as required by law and/or public health needs. With the comfort of the FDA approval, we join a growing list of public colleges and universities across the country that are taking a similar approach, including but not limited to Michigan State, Purdue, hundreds of others actually, many of our peers, along with many of the nation's leading private colleges, including most of those in Minnesota. details on timing and grace periods for the vaccine requirements, some of the IT that we're standing up on how to report, and how we'll work failure to comply and the consequences for that are forthcoming, being managed through shared governance. And in the interim, we strongly encourage all students to get the vax now. We've been communicating with our entire community that show how easy it is to obtain the vaccine these days, why it's safe, with insights particularly from Dr. Jacob Tolar in that space, and reminded our entire community that the governor is offering a $100 incentive for those who obtain the vaccine in the state of Minnesota. Now, for faculty and staff, we don't currently have a vaccine policy, so we are not asking for board action in this place, but faculty and staff are part of the Get the Facts 2.0 plan. For them, and with appreciation for the shared consultation that we have had up to this point, and that is continuing, we anticipate that they would confirm that they're vaccinated through an online attestation that would state that they are either fully vaccinated against COVID-19 and will get tested if exposed to someone who has COVID-19 symptoms, or in the case that they have not yet received the COVID-19 vaccination, they would test via a means and frequency to be determined, and would also test if they're experiencing symptoms or test if exposed to someone with COVID-19. And if under any of these circumstances, they received a positive result under a COVID-19 test, they would follow CDC guidance, including isolation and participation in contact tracing efforts, and follow that guidance in making the decision on when to return to work. And of course, for faculty and staff, we've issued the same instructions on how easy it is to get the vaccine, what the safety parameters are, which are extremely strong, and that the governor is offering the incentive. These are both members of the board last mile. I should remind everyone that we have surveyed our faculty, staff, and students, and most of our campus community, in fact, the vast majority of our campus community responding to the survey are vaccinated. So this is to close as much of the gap as possible in order to ensure that the Delta variant and other variants that may be coming do not interfere with our strong desire to have the most robust fall semester we possibly can. In terms of how we got to this point, we are following the same methodology and processes for Get the Vax 2.0 that we've utilized since this pandemic began 20 months ago, and in some ways feels like 20 years ago. We have a representative shared governance committee that includes expertise and counsel from public health experts and medical experts. We've relied on state and federal guidance. We've analyzed the data, the science, and the accompanying trends, and adjusted with some frequency to make graceful pivots as new information and circumstances dictate. And we suggest to you, members of the board, that we are at one of those moments now. As we make one of these graceful pivots to protect our university community's health and safety and keep us on campus and in person, I want to sincerely thank our students, faculty, and staff who have really been exemplary in their commitment to shared safety. I would also like to express my gratitude for being part of a community that's really invested and strongly advocates for meeting the needs and aspirations and concerns of every one of its members and all of its varied points of view and opinions, and include through our commitment in all deliberations to elevate equity and ensure that this plan is fair and just and creates full access to the vaccine. So members of the board, we don't have answers to all of the questions today, but we are standing up a virtual town hall to answer the questions and to continue to inform our community in the most effective way possible about Get the Vax 2.0 and the fall semester in general. So I encourage everyone to join the Senate Consultative Committee and me, along with other university leaders, at 9 a.m. on Wednesday, August 18th for this virtual town hall. So last but not least, I want to extend my thanks to all of you members of the board for your continued support during this challenging time and for all you do for the University of Minnesota. And with that, Mr. Chair, I offer this proposed resolution for your consideration. Thank you.
All right. Thank you, President Gable. And colleagues, before we turn to discussion, I'll entertain a motion to approve the resolution related to change to university immunization requirement. Is there a motion to approve the resolution?
So moved.
And is there a second?
Second.
All right, it's been moved and seconded. While we're waiting for hands to go up, and I'm just going to switch to so that I can see those. Let me just make a few comments. First, I want to thank President Gable for this very important resolution. and the work that supports the resolution. The president consults extensively, as you've heard, with medical and public health experts, and this resolution reflects that input. And that input is clearly among the very best expertise in the country. She's also consulted broadly across the university. And President Gable, I want to thank you for your leadership and your respect for shared governance as you work your way with us through these very challenging issues. And let me just close my brief comments by saying, look, fellow Regents, we need to take action here to prevent another period of remote learning in our university, triggered by another surge in the violence in the pandemic. This resolution will allow us to do that. As you've heard from many public health experts, these vaccines are among the most effective in history. We're very fortunate to have them. Let's use them. So I'll be strongly supporting this resolution. Now let me look now and see, Mr. Steves, if you can give me, I'm not seeing hands.
We have Regent Farnsworth
here we
and
go.
Regent Rocha.
Okay. All right, let's go to Regent Farnsworth.
Thank you, Chair Powell, and good afternoon, colleagues here in the boardroom and on screen, as well as administration and members of the university community tuning in. Just want to make a few brief comments and pose a few questions for the record, so appreciate the indulgence of the chair and colleagues in advance. First and foremost, I want to thank everyone who took the time to reach out via phone, email, or other methods of communication about today's discussion and vote on the administration's proposed COVID-19 vaccination policies for students, staff, and faculty. Today's vote is really important, as Chair Powell just put it very well, and that reality has also been weighing on me in the preceding days. I believe it's essential we do everything we can as an institution to ensure a healthy, safe, and robust in-person experience for students this fall across all of our system campuses. I'm acutely aware, as of course as everyone else, of the many losses our students have faced throughout the pandemic, and taking this step today to authorize a framework regarding COVID-19 vaccinations for students, staff, and faculty is a critical step in doing everything we can to ensure that classic in-person college experience for the many students and families that are seeking it. So thank you to President Gable and her team, who have been working really hard to navigate us through these constant but necessary pivots. A few brief comments on the resolution. I intend to support the resolution before us today. However, since it's core to our role to engage in public dialogue and discernment around issues of consequence to the university, I'm just going to pose a few questions for the record that are based on engagement that I've had with university stakeholders over the last few days. So question number one is, it's my understanding that primarily within the student community, but not exclusively, that there's some level of concern with the lack of parity between the proposed mandatory vaccination policy for students and the proposed attestation for staff and faculty. Based on my reading, it seems that that theme was also at least touched on in a letter the board received last night from University of Minnesota Shared Governance leaders, which stated, quote, "We endorse the implementation of a universal vaccination requirement for all university community members or regular testing, along with testing under specific circumstances." Additionally, some other feedback that I've heard specifically regarding the proposed student vaccination policy is concerns regarding the timeline, given the fact that the proposed student policy would take effect 6 weeks after the to be determined FDA approval. There's some concern around the timing of when the mandate would go into place and perhaps feeling that that might be too late. So one suggestion that was proposed to perhaps mitigate that would be to require an immediate attestation from all university community members, which would be especially beneficial to our Crookston and Morris campuses and system campuses that are perhaps starting earlier than here in the Twin Cities, which could lead to an increase in compliance and allow for additional consultation on vaccination policies for all constituencies. And then finally, one other thing I wanted to ask for the record is what, if any, statutory exemptions are we not allowing for students? So apologies, I know that was a lot. It really boils down to one, the concern around lack of parity between the policies, two, effectiveness of timeline, and three, exemptions. Again, wanted to get those questions out there because that's at least, those are major themes that I'm hearing from members of the university community, but I am very supportive of us moving on this today, but felt it was important to ask those. So thank you.
Thank you very much for your comments, Regent Farnsworth. President Gable, would you like to comment?
Yes, Chair Powell, Regent Farnsworth, we are hearing the same questions, and we'll go into detail on the answers to some of those questions during the town hall, because there is some underlying research associated with each of them. But from a sort of the high level view, the lack of parity is not intended to give either side a better opportunity to avoid getting the vaccine. The difference in how faculty and staff are being treated from how students are being treated is a reflection of the fact that students are currently covered under a vaccine mandate policy and faculty and staff are not. And in the interest of moving this forward sort of in the shortest distance between 2 points, we are updating the student policy and then creating something close to parity by having faculty and staff attest. Now, there's nothing that prevents us from down the road, if necessary, adding the attestation to students or updating the policy to include faculty and staff in the mandate. But I'll mention, and this relates to your second question about timeline as well, that the vast majority of our community is already vaccinated. So this is the last mile gap closure. And both of these methods are effective methods for closing the gap. And that's the goal here. So it's nice when every single constituent is treated exactly the same way, but we come to you today from a starting point where they're not treated the same way. And these two facets of the policy are intended to get both groups to the same outcome. That's the goal there. Now, in terms of the timeline and the concern about the timeline, again, because the vast majority of our community is vaccinated and we have the mask mandate for indoor spaces, there is a lot of data to suggest that the risk is already low. But the idea of mandating the vaccine prior to FDA approval caused great concern for certain members of our campus community. FDA approval also reflects a fork in the road moment in terms of the public health perspective, in that it is a different type of vaccine once it's FDA approved, fully FDA approved, rather than emergency use approved. And so that was the reasoning for that timing. We expect that to be soon. If it's not soon, then we can always come before this board with a change. If there's a change in the imminence of the approval, we could return with additional action to increase the speed. But the speed made sense for where we are today, with the amount of transmission we have today, and with the timeline that we expect with the timing of the start of the semester. And it also comports with the existing language of the vaccine mandate, which in policy for tetanus and other vaccines that students are required to have gives a grace period. And we wanted to be consistent in that regard. With regard to exemptions, the exemptions that remain intact for the COVID-19 vaccine are medical, with the appropriate documentation from a clinician, and religion as per law. Those are the exemptions that we are carrying over. Thank you, Mr. Chair.
Thank you, President Gable. Mr. Steves, could you just update me on who would like to speak? I have Regent Rocha next, and then
Regent Swigum.
Okay, very good. Regent Rocha.
Thank you, Mr. Chair. And thank you to President Gable. I appreciate the dialogue that we've had on this and your responsiveness to questions. I have a few additional questions, and I guess I'll jump into it. So on the last point that you just addressed for Regent Farnsworth, so to be clear, our current policy with respect to the previous vaccination requirements, if I'm tracking correctly, had 3 exemptions. There was, I believe, it was a medical, a religious, and what term is used? Conscientious. What's the third?
If you have it in front of you.
Right. And so as far as the previous for the other materials. So then, so this isn't, if I'm understanding it right, we're not just putting the COVID vaccine into the list. It's treated differently than previous vaccinations. Is that accurate?
Yes, that's accurate.
Okay. And I guess I have a bit of a legal question. So and I appreciate the sensitivity of the issue of treating 20-some thousand faculty and staff differently than the 60-some thousand students. But we could, if I'm if I'm tracking correctly from what's recent holdings and so on, that we could make a condition of employment that everybody follow the same procedure or the same requirement for vaccination. I don't know if that's something for the general counsel or Mr. Chair.
President Gable or general counsel, whoever would like to comment on that point.
Yeah, I'll defer to general counsel, Mr. Chair.
Good afternoon, if I might. Certainly there's a legal framework that is in the background to the decisions you're making today that I would say channels the choices that are before you, but I do not believe you should proceed in a way that feels as if you are confined by the legal risks and limitations that are there. I think your priority, as President Gable emphasized, should be on public health judgment and appropriate public health policy. And, there are certainly legal questions with each choice you make, but for purposes of today's decision, to me, it's essentially a policy judgment question, not an issue of the law eliminating choices or only offering you particular choices. So hopefully that's helpful.
All right, thank you, General Counsel. Regent Rocha.
Thank you, Mr. Chair. I appreciate that. There's a couple other sort of technical things. One is the resolution in front of us provides that we are endorsing the addition. Is that significant as opposed to approving the addition, or and then the second part about the actual resolution itself is I don't think it includes a resolution related to the faculty staff portion. It only addresses the student portion. Am I tracking that right?
President Gable, over to you, or perhaps Mr. Steves, help us decide who would like to take that.
I'll take the second part, and then I'll defer to Mr. Steves on the difference between endorsing and approving. The faculty staff portion is not something that results in a change that we are seeking approval. That is a collective voluntary action that we are informing the board about as we inform the board of the entire Get the Vax 2.0 plan, much like we did with the reinstatement of the mask policy. The only thing that requires approval, as our understanding, is the change to the student policy.
Thank you, President Gable. Mr. Steves, would you like to comment on, endorsement versus approval?
Yes, Mr. Chair and Regent Rocha. So the requirement to have students vaccinated and what vaccines are required is something that's within the administration's delegated authority. It's not something that typically the board would vote on to add, tetanus or, some of these other vaccinations to that list. And so in this case, that language and that word choice was used to reflect the fact that typically the administration would make that decision on their own. And in this case, the board is endorsing. So there was a desire to have the board involved in this decision. And so the word choice was to use endorse.
Regent Rocha.
Thank you, Mr. And thank you, President Gable and Director Steves. That's very helpful, and I appreciate that it's been brought because obviously this has been a matter of substantial public dialogue. So, I find it. I'm sorry.
One more comment, Regent Rocha, and then I want to move on.
Yeah, I appreciate that, Mr. Chair. So going back to kind of the legal matter on this is I'm looking at the letter that we received from our shared governance, and the endorsement is of the universal vaccination requirement, which is I think was just kind of described as the voluntary approach with regular testing and testing under specific circumstances. There's not a statement in favor of the policy that's directly in front of us. And I understand there's just a whole lot of stuff to balance here, but my concern is that from a legal standpoint, if this requirement is challenged, and it's especially going to be challenged because of the removal of the exception on conscientious objection or exemption, when someone, whether you're talking about a rational basis or whether you're talking about a strict scrutiny, application. We don't necessarily know which one will be applied. But when we have 27,000 people under a different policy, I'm struggling to understand how we can say that this is narrowly tailored when we have, fully a third of our folks, or roughly a third, I should say, of our folks under a different standard. And so from that standpoint, I find a level of discomfort in applying different standards to different folks. I certainly haven't seen anything that would indicate that the virus differentiates between people's status as students or staff or faculty. And so from that standpoint, if we're going to be sincere about our perspective on this, I think that all parties would be treated the same. And so to that extent, I would move to amend the resolution to change the resolved function from that which was described to the language that comes from our shared governance, which is endorsing the implementation of a universal vaccination requirement for all university community members or regular testing, along with testing under specific circumstances.
Is that a motion, Regent Russia?
It is, Mr. Chair.
It's been moved to
Second.
And is there a second?
Yes, second, Mr. Chair.
Okay. Mr. Steves, can you, I was taking notes as quickly as I could, but perhaps you can capture the essence of the amendment.
Mr. Chair, as I understand the amendment, it is to strike, I don't have the exact language, but to strike the provision limiting it to students and instead have the board endorse a universal vaccination requirement and some of the related testing language. So I don't have the exact language, but I'm just hearing it in real time as well.
Mr. Chair, if I
Yes.
can, I was reading right off of the letter that we received from the Senate office. So it's starting with endorsing the implementation of universal vaccination requirement for all university community members for regular testing, along with testing under specific circumstances. It's the bold language in that letter.
Yeah. Thank you. Moved and seconded. President Gable, my sense is that given the amount of discussion across a variety of stakeholders, this would be a very challenging amendment at this point, but I'd ask you to comment and give us your thoughts on the amendment.
I have high ambivalence about this amendment, as this board may not be surprised to hear that if the board is seeking to solve a legal problem, contrary to what they just heard from General Counsel Peterson, that is within your prerogative. In terms of the public health issue, both of these methods achieve the same desired goal, which is to close the last mile in terms of vaccination. And that is why it's presented this way, is because we currently treat faculty and staff differently from students in this particular space. We treat faculty and staff differently from students in lots of spaces. And in this particular space, this was the way to get both groups to the same end. But the overall desire to mitigate the consequences of the Delta variant and future variants is a shared goal. I mean, if that's what we're all trying to do.
All right, thank you. Does anyone else, would anyone else like to speak to the amendment? And Mr. Steves, if you can just, again, help me, since I don't seem to see. I see Dr. Johnson's hand up. Or anyone else that you see? Mr. Steves, who wants to speak?
Mr. Chair, we had Regent Swigum and Regent Johnson on the list for the main motion. I'm not sure if they're wishing to speak to this proposed amendment.
All right. Regent Johnson, do you want to speak to the amendment, or do you want to hold your comments?
No. I will hold my comments.
Okay. And Regent Swigum, do you want to speak to the amendment, or do you want to hold?
Yes, Mr. Chairman, not to the amendment, so I will hold.
Okay. So there being no questions or comments that I can see, Mr. Steves, will you call the roll on the amendment?
On the Rocha amendment, Regent Davenport.
No.
Regent Davenport votes no. Regent Farnsworth.
No.
Regent Farnsworth votes no. Regent Hipsch.
No.
Regent Hipsch votes no. Regent Johnson.
No.
Regent Johnson votes no. Regent Kenyanya.
No.
Regent Kenyanya votes no. Regent Mayron.
No.
Regent Mayron votes no.
No.
Regent McMillan.
No.
Regent McMillan votes no. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Swigum.
No.
Regent Swigum votes no. Regent Verhalen.
No.
Regent Verhalen votes no. Chair Powell.
No.
Chair Powell votes no. Mr. Chair, there is 1 in favor and 10 opposed.
Okay, that motion fails. Let's turn back now to our commentary on the main motion. And as you heard, we had Regent Johnson wishing to comment on the main motion.
Okay. Thank you, Chair Powell and President Gable and our fellow regents. I want to just step back a moment to discuss this resolution. So our freedom as Americans is enshrined in our Constitution, our Bill of Rights, and they are foundational to our democracy. I think this freedom of the individual must always be balanced by a responsibility to care for our community. I believe there's a deep American ethic to support and care for our neighbors. The preamble of our Constitution, which begins with the "We the People" clauses, includes promoting the general welfare. And I think in this case, where we have, as regents, have actually sworn an oath to uphold the Constitution and these values. In this context, I believe that promoting the general welfare is, in fact, here a mandate for public health initiatives. As the president said, we all want to do 2 things. First, we want students of the University of Minnesota on all our campuses to be able to meet in person on campus for their classes and all related activities this fall. And secondly, we want our entire University of Minnesota community, students, faculty, and staff, to be able to do this safely. The only way we can hope to have our community on campus, in classrooms, in dorms, and proceeding in this way is for us to observe the masking mandate and to strive for as near universal vaccination among our students and other constituencies as quickly as we can. Let me just mention a few of the Delta variant facts. This is by far the most infectious COVID virus we have seen. It is 1,000 to 1,200 times, or 1,000 to 1,200 times more viruses in any given infected individual's nose than with the prior COVID viruses. That virus, the initial one, on average infected 2 to 4 people. Current Delta one, on average 9 people. It also is affecting younger people more. That's children, adolescents, and young adults. The FDA is close to approval of the Pfizer vaccine, first one up, and that may be as early as the end of this month. I've talked to vaccine research experts at Mayo and other places. It could be then, otherwise likely in September. And essentially, there is no chance the FDA will not approve this. It's really just a matter of when, not if. And for context, I'd like to note that in 2020, more Americans died of COVID in a single year than died in 4 years of combat in World War II. At present, we're already seeing Delta raging through states like Texas and Florida, where there are low vaccination rates, and in other states in the South and West. We are very fortunate that this Delta virus can be prevented by our current vaccines. At the present time, there are 90 million Americans who are eligible but have not yet been vaccinated. And the more people that are unvaccinated with these huge viral loads, what we see then, what happens is that these viruses multiply and multiply and multiply. And as they do, they make mistakes and the DNA is changed. That is a mutation. And it's that kind of a mutation that will create the next variants. And the more unvaccinated we have, the more likely that is to happen. And the other thing that's a great concern is that while Delta fortunately is largely preventable by these viruses, the next variants may not be. And that will be a far more serious scenario than we have that now. I'll just say for all of these background facts of science and medicine of this, and as what I have seen and learned in the last 18 months as a practicing physician at the Mayo Clinic in Rochester, Minnesota, I would like to strongly encourage all of us to endorse the proposed vaccine mandate. It is the best, and I really believe the only way that we can have a safe academic year on campus at the University of Minnesota. Thank you.
Thank you very much, Regent Johnson, for those comments. And I should say sobering comments. So we really appreciate your input. Regent Hipsch.
Thanks, Chair Swigum. My comments will be really short. I am for supporting this amendment or this resolution. You know, we've come a long way since the beginning of this pandemic. It's been difficult. All the decisions are difficult, and not everybody is going to be in agreement. But I worry that with rising infections and hospitalizations, we don't get this under control, we may have a more damaging and threatening variant coming down the road. And I think the best way to get students safely back onto campus is through this vaccination and through masking, as fellow Regent and Dr. Johnson has just mentioned. So I support this vaccine, and I know not everybody is going to be in agreement of it, but I think it is the best and really the only way to go forward. Thank you.
Thank you, Regent Hibbs. Appreciate that. Regent Rocha will give you one more question, and then I'm going to let Regent Swigum wrap it up.
Thank you, Mr. Chair. Not a question so much. I appreciate the gravity of the situation. I appreciate the substantial risk. We could obviously have a very long conversation, as our society has been having for months and months now, about balancing these various interests. I would be in a position to support this, even with the differential treatment, although I still don't believe that that's valid in my view. I think that we could treat, as our letter from the Senate provided, that we could treat people the same and seek to achieve that closing of the gap. And you know, the fact is that the Constitution, you know, for a couple centuries now has had to balance these issues of safety and security and other rights and interests. And you know, spending a year with rockets chucked at you for the purpose of preserving those rights maybe has a bit of an impact on a person. But the fact, if this, even if it was a differential treatment, but retained the exemptions that are in our current policy for folks based on the three different categories versus just the two, would bring me to support the policy more directly. But as it is, as we're treating these differently, I can't bring myself to support it today. We certainly will have other opportunities, I think, coming forward when the FDA takes action and so on to revisit these issues if necessary. And then finally, you know, I do note that there is a differential between different ethnic groups on vaccination rates, and I don't know if that stands for our particular student body numbers or faculty staff numbers, but I would want to be certain that we're not losing other values that are significant, such as access to this based on those types of differentials, and that we have a way of monitoring that and keeping the board informed that that's not having that impact. But fully support the intent of maximizing safety and health on campus. But as this is written right now, I will not support it. Thank you.
All right. Thank you, Regent Rocha, for those comments. Regent
Mr.
Swigum.
Chair, we have Regent Kenyanya on the list as well. Sorry, Mr. Chair.
All right. Regent Swigum.
Mr. Chairman, thank you. Mr. Chairman, first of all, you're not being present here, in the McNamara meeting. I want to tell you have a little procedural problem here, Mr. Chairman. You had Regent Kenyana both make the motion of the resolution and second it. Oh, I'm just kidding. I think Regent Farnsworth got his voice in over Mike's voice, I think. So I was just giving you a hard time, Mr. Chairman. I never tried.
Well, that's the first time you've ever done that, Regent Swigum.
I realize that. And it'll probably be the last two, Mr. Chairman.
Yeah.
Maybe more to, not to Regents as much as to the general public that have contacted us, and appreciate those contacts, whether they be by emails or phone calls or just meeting people on the street. Contact us significantly on this very, very important issue. Comments more to them, to the general public, than to Regents. There's a rule called the rule of reasonability. The rule of reasonability basically says that you're never going to get everyone to agree on any policy. And we understand that, we recognize that, but if you're making a decision and you have a few people on one side of an issue and a few people on the other side, and 60, 80, 90% in the middle in acceptance, you generally probably have a pretty good policy. And President Gable, I think that's where you've landed, is in a pretty good, acceptable public policy. The rule of reasonability, first and foremost, it's reasonable to want to keep your community healthy and safe. That's reasonable to be able to want to do that. We have both the ethical and we have the legal responsibility to provide for a safe workplace for our community. First and foremost, I guess I already used first and foremost, so this should be second and foremost. It is reasonable to do everything we can as a public policy board to provide for in-person instruction this fall. Folks, we have to have in-person instruction. We have to have our students on campus and our professors on campus. Doing this vaccination mandate provides a pathway, I believe, to maintain the in-person higher education experience here at the University of Minnesota. Not doing the mandate, not making sure everybody is vaccinated, does just the opposite. I think it puts in jeopardy our ability to be in person, significant jeopardy. And we have to make sure we bear that in mind. I think it's reasonable to want to enact the mandate after the FDA approval. This would give a little more comfort. I think it would give a little more acceptance to the general public that the FDA has approved, and probably a little better legal standing for us too as a university. By the way, we're probably going to get sued no matter what decision we make. But you certainly want to look at the legal liability and limiting that as much as you can. I think it's reasonable to recognize exemptions, whether they be health exemptions, whether they be exemptions having to do with religious reasons. That's a reasonable exception to look at. So you look at those reasonabilities, and I think you come down to the Get the Vax 2.0 plan, President Gabel's recommendations that she brings to us, the resolution she brings to us, is reasonable. Not that everybody will agree with it. Certainly not. We've received numbers of emails, numbers of comments from people who will not agree with it. But we need to look at that rule of reasonability. And I think President Gabel has struck that with her recommendation. And for the university community, as well as the general public, this resolution fits well in that sweet spot of reasonability. Thank you, Mr. Chairman.
Thank you. Thank you very much, Regent Swigum. And Mr. Steves, just again, if you could update me since I can't really see very well, is Regent Kenyanya, he'll be the final speaker?
I believe that's right, Mr. Chair.
All right, Regent Kenyanya, bring us home.
Best for the last, Mr. Chair. Thank you very much, Mr. Chair. Everyone participating in this dialogue, and President Gabel and team for the presentation. Appreciate the conversation that's being had, and a lot of the comments, especially some of those from Regent and Dr. Johnson. I think it's more appropriate to say Dr. Johnson in this setting. But I want to speak to two pieces. And one is to, I guess, dispel the misconception that this is new or novel, just in terms of this kind of practice of mandating a vaccine, both in this country and from this institution. I mean, it's a long-standing practice and policy, that people didn't think much about before. I think all of you in your personal lives, either yourselves or your children, have experienced this probably through schools and whatnot. For myself, the first time was in Nairobi, Kenya, at the U.S. Embassy, when they said, we'd love to have your family here, but there's this list of vaccines that you're going to have to comply with, and we probably had some of them, and others we had to go get, right? And then through the school process, you encounter that, and even at the university before this. So there's nothing new or novel about that. I think it's important, and there's not unanimous support, but there certainly is broad support. And for the folks that disagree and might make decisions, possibly enrollment decisions accordingly, they'll be doing what they think is best for their health. And I think based on our understanding and our experts' understanding, I think we're doing the same for this community by implementing this policy. And then the second comment is response to a very excellent point that Regent Rocha brought up, briefly touched on at the end there, and that's about equity, right? We know that vaccination rates are lower in Black and other communities of color, and it's an excellent point that I've thought about a bit. And you know, I definitely support the vaccines, but it's for good reason, right? And Black and other communities have some historical reasons to mistrust the U.S. government and this institution and other institutions in terms of vaccines and other things like that. However, in thinking about that, I realized these are also the same communities that have the worst outcomes because of the pandemic, right? It's been widely written about, better articulated than I can, you know, because these are communities with less access to healthcare, who are more likely to be frontline workers, who are more prevalent in healthcare and whatnot. So while that is an important point, and you know, one we think about and talk about often here, today in this context, in this setting, I feel that I'm more compelled to act in the you know, best public health interest of Black and other minority communities. You know, it might not be our students per se, but you know, their parents, right, their family members who may be more at risk than the very possible but also unknown equity and enrollment piece that Regent Rocha brought up. If you know, if such students were to make enrollment decisions based on the vaccine, so I will be supporting the resolution. Encourage others to. And on that last point, you know, I hope we continue looking at other issues with that lens that Regent Rocha brought up. Thank you, Mr. Chair.
Thank you, Regent Kenyanya, for those important points. Thank you, Mr. Steves. Do we see any other hands raised?
Mr. Chair, I do not.
All right. There being no additional comments or questions, Mr. Steves, will you please call the roll?
On the resolution, Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Farnsworth.
Yes.
Regent Farnsworth votes yes. Regent Hipsch.
Yes.
Regent Hipsch votes yes. Regent Johnson.
Yes.
Regent Johnson votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes. Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
No.
Regent Rocha votes no. Regent Swigum.
Yes.
Regent Swigum votes yes. Regent Verhalen.
Yes.
Regent Verhalen votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 10 in favor and 1 opposed.
All right. 10 in favor, 1 opposed. The motion carries. Thank you to all colleagues for a very thoughtful discussion and commentary on this issue, which is obviously very challenging and very, very important to our community. Thank you. Moving on to item 2, before us for review and action is a non-audit consulting agreement related to the PEAK initiative, and Associate Vice President Volna will join us and he'll introduce the item.
Thank you, Chair Powell, members of the committee. You have before you a request to approve an engagement with KPMG for continued work on the PEAK initiative. As you know, KPMG has been a part of the initiative since its beginning. Since the July meeting, the administration has been working hard to develop both the scope, finish up phase 1, and plan for the next phase of this. The interest and desire is to have KPMG continue in their role of helping HR with their transformation. In looking at the scope of work that was developed, there are no impairment issues with respect to KPMG. They currently do not do any audit work for us, but in the event that they were ever to be hired in the future, this work would not impair them from doing that. So I stand for questions and we request your approval.
All right, thank you, Associate Vice President Volna. I would like a motion before we turn to discussion. Is there a motion to approve the non-audit consulting?
Move approval.
agreement? I hear
Second.
a motion and I hear a second. Any hands raised either in the boardroom or let's see here. You see, I see one hand raised. Any hands raised in the boardroom, Mr. Steves?
Mr. Chair, I'm not seeing any hands in the boardroom.
All right, I see Regent Rocha with his hand up. Regent Rocha.
Thank you, Mr. Chair. Just real quickly, we've been having a dialogue, the administration with the audit committee, Regent Kenyanya, now chair, and myself over a period of time, and so I'm comfortable that that this has been well vetted and provides that the distance that I think we need to maintain this. I would just caution in the future that we work very hard. We're in a large market and lots of different companies, and that we work as hard as we can to again try to maintain that independence in our auditing function from other activities. And I don't believe this goes too far, so I will support it. But just want to remind the board as we go forward that level of separation, I think, is really important, and just to be mindful of that as we go forward. Thank you, Mr. Chair.
Thank you, Regent Rocha. Noted, and appreciate the comment. Do you see any hands up in the boardroom, Mr. Steves?
Mr. Chair, I do not.
All right, will you then please call the roll?
On the KPMG engagement, Regent Davenport.
Yes.
Regent Davenport votes yes. Regent Farnsworth.
Yes.
Regent Farnsworth votes yes. Regent Hipsch.
Yes.
Regent Hipsch votes yes. Regent Johnson.
Yes.
Regent Johnson votes yes. Regent Kenyanya.
Yes.
Regent Kenyanya votes yes. Regent Mayron.
Yes.
Regent Mayron votes yes.
Yes.
Regent McMillan.
Yes.
Regent McMillan votes yes. Regent Rocha.
Yes.
Regent Rocha votes yes. Regent Swigum.
Yes.
Regent Swigum votes yes. Regent Verhalen.
Yes.
Regent Verhalen votes yes. Chair Powell.
Yes.
Chair Powell votes yes. Mr. Chair, there are 11 in favor and none opposed.
All right, 11 with none opposed. That motion passes. Thank you. And thanks everyone for joining us with this special meeting today. We had everybody. There being no additional business before the Board of Regents, this meeting is adjourned.